Welcome to the Certified Hospital Housekeeping and Facility Hygiene Manager course. This introduction sets the stage for understanding the critical role of hygiene management in healthcare settings. Clean hospitals are vital for saving lives. Beyond advanced technology and skilled doctors, maintaining hygiene and sanitation is crucial for patient safety. Healthcare facilities operate under constant hygiene pressure, with activities around the clock and continuous contamination risks. Infection prevention starts with environmental hygiene. Understanding contamination pathways is key to effective hospital sanitation. Patients judge hospitals by cleanliness, with first impressions and visible hygiene impacting their perceptions and satisfaction. Housekeeping teams support every department, playing a crucial role in maintaining healthcare facility operations. Modern hospital hygiene requires professional skills, focusing on technical knowledge, operational discipline, and safety awareness. Technology is transforming healthcare hygiene management, with advanced systems enhancing sanitation efficiency and effectiveness. Safety is crucial for housekeeping staff, with proper equipment, protocols, and training essential for their protection. Continuous monitoring is essential for maintaining hospital hygiene, requiring structured systems and accountability. The future of healthcare depends on hygiene excellence, with operational skills, technical expertise, and leadership being essential. Understanding the role of hospital housekeeping is crucial in modern healthcare. It forms the foundation of safe, effective, and trusted healthcare delivery. Cleanliness is essential for patient safety. Hospitals must ensure hygienic environments for patients, visitors, and staff to prevent infections and promote health. Hospitals operate 24/7, with different tasks scheduled throughout the day to maintain hygiene and patient care. Maintaining clean environments is key to reducing infection risks in hospitals. Breaking the chain of infection is crucial for patient safety. Patients often judge hospitals by their cleanliness, which influences their trust and confidence in the facility. Housekeeping supports every department, ensuring hygiene and smooth operations across the hospital. Hygiene is a key part of infection prevention, involving sanitized rooms, disinfected surfaces, and proper waste disposal. High-touch surfaces require constant attention to prevent the spread of infections in hospitals. Housekeeping staff are integral to the healthcare team, contributing to patient safety and operational readiness. Healthcare facilities face unique cleaning challenges that require specialized protocols and expertise. Patient rooms must remain hygienic to ensure patient recovery and prevent infections. Operation theaters require extreme cleanliness to prevent infections and ensure successful surgical outcomes. Healthcare waste must be managed safely to prevent exposure to pathogens and ensure environmental safety. Hand hygiene is crucial for environmental hygiene, preventing the spread of infections in healthcare settings. Improved housekeeping practices can significantly reduce infection rates in healthcare environments. Technology is enhancing hospital hygiene operations, making cleaning more efficient and effective. Housekeeping directly impacts hospital reputation, influencing patient trust and regulatory compliance. Coordination between departments is essential for effective hospital hygiene and sanitation. Housekeeping staff must follow safety procedures to protect themselves and ensure effective hygiene management. Cleanliness is a continuous process requiring structured schedules, inspections, and audits to maintain high standards. Hospital hygiene requires adherence to professional standards to ensure effective cleaning and infection control. Explore the essential systems, standards, and practices that ensure healthcare environments remain safe for everyone. Hospitals must maintain controlled, safe, and hygienic environments to protect vulnerable patients, reduce contamination, and ensure operational safety. Hospital cleanliness relies on structured sanitation systems, ensuring every aspect of environmental hygiene is addressed. Preventing healthcare-associated infections is crucial worldwide. Effective hygiene controls in patient rooms, equipment, and waste systems are essential. The World Health Organization sets international standards for healthcare sanitation, influencing hospital protocols globally. Accreditation organizations set benchmarks for hospital hygiene, influencing infection control and patient safety practices. Hospitals classify areas based on infection risk, ensuring appropriate hygiene standards are maintained for each. Critical areas like operating theaters require stringent infection control measures to protect patients. Cleaning and disinfection are distinct processes, both essential for maintaining safe healthcare environments. Regular cleaning of high-touch surfaces is crucial to reduce contamination risks in healthcare settings. Color-coded cleaning systems prevent cross-contamination, enhancing operational hygiene safety. Airborne contamination controls, like HEPA filtration, are vital for maintaining hospital hygiene. Water quality management is crucial in preventing bacterial contamination and infection risks in hospitals. Proper waste management is essential to prevent infection and maintain hygiene standards in healthcare facilities. An ICU case study highlights the importance of identifying problems, conducting audits, and strengthening protocols to improve hygiene. Regular audits help hospitals maintain hygiene standards by tracking cleaning tasks, PPE compliance, and waste disposal. Continuous training in disinfection techniques, PPE usage, and chemical safety is vital for maintaining hygiene standards. Digital systems improve hygiene monitoring by providing real-time data and automated reporting. Patients feel more confident when they observe active cleaning and hygiene practices, enhancing trust and reputation. Effective hygiene standards protect patients, staff, and visitors, ensuring a safe healthcare environment for all. Understanding hygiene standards and infection prevention strategies is crucial for maintaining safe healthcare environments. In this chapter, we delve into the crucial roles and responsibilities of hospital housekeeping managers, focusing on leadership, planning, and sanitation management in modern healthcare environments. Modern hospitals rely on organized housekeeping systems to maintain cleanliness, infection prevention, and patient confidence. Effective management requires skilled supervision and coordination across departments, ensuring a safe and hygienic environment. Housekeeping managers play a vital role in monitoring cleaning schedules and ensuring hygiene across various hospital areas, including patient wards, operation theaters, and laboratories. Consistent hygiene is crucial for patient safety. Proper sanitation is essential to reduce infection risks and operational disruptions. Housekeeping managers ensure that hygiene practices support patient care and safety, emphasizing the importance of environmental hygiene. Effective staff supervision involves assigning teams, monitoring performance, and maintaining discipline. Strong leadership ensures consistent sanitation protocols and operational efficiency across hospital departments. Hospitals operate continuously, requiring strategic shift planning to ensure uninterrupted cleaning coverage. Housekeeping managers organize shifts to cover all areas, supporting smooth hospital operations. Routine inspections help identify hygiene issues before they escalate. Housekeeping managers ensure that all areas, from floors to equipment, meet cleanliness standards, promoting accountability and quality. Housekeeping managers collaborate with infection control teams to maintain hygiene compliance. Effective coordination ensures that disinfection practices, isolation cleaning, and waste segregation are properly managed. Housekeeping managers ensure the correct use of chemicals, following dilution methods and safety practices. Proper handling prevents safety hazards and ensures effective disinfection. Biomedical waste must be handled according to regulations to prevent contamination risks. Housekeeping managers oversee waste collection and disposal, ensuring compliance and safety. Regular maintenance of cleaning equipment ensures functionality and hygiene quality. Housekeeping managers are responsible for keeping equipment sanitized and properly functioning. Comprehensive training programs improve staff knowledge in infection prevention, chemical safety, and emergency cleaning. Continuous training ensures adherence to hygiene standards across departments. Housekeeping managers coordinate with various hospital departments to ensure effective communication. Strong partnerships with nurses, infection control officers, and others are essential for operational success. In emergencies, rapid assessment and deployment of cleaning teams are essential. Housekeeping managers ensure that hygiene protocols are followed to prevent further contamination. A hospital faced increased infection risks during a patient surge. By enhancing sanitation frequency and adjusting shifts, the housekeeping team effectively managed hygiene, reducing infection spread. Accurate documentation of cleaning activities and inspections supports operational tracking and quality control. Housekeeping managers ensure that records are maintained for audit and compliance purposes. Housekeeping managers play a key role in meeting accreditation standards through effective sanitation and hygiene practices. Their efforts ensure compliance with environmental and infection prevention requirements. Successful housekeeping managers demonstrate leadership through operational planning, communication, and problem-solving. Their skills ensure that hygiene standards are maintained under pressure. Digital tools and automated systems are transforming housekeeping management. These technologies improve supervision, optimize operations, and ensure high hygiene standards. Effective housekeeping management enhances patient confidence and reduces infection risks, strengthening the hospital's reputation. Their role is crucial in maintaining high standards of care. Daily operational discipline is essential for infection prevention in hospitals. Housekeeping managers play a key role in maintaining sanitation and cross-contamination control systems. Infection prevention and cross-contamination control are crucial in healthcare settings. This chapter provides a comprehensive guide to protecting patients, staff, and environments through disciplined sanitation systems. Hospitals must constantly work to prevent the spread of infections. Patients with weakened immune systems are particularly vulnerable, making infection prevention a critical responsibility in healthcare environments. Cross-contamination occurs when harmful microorganisms spread from one surface to another. Understanding these pathways is key to preventing healthcare-associated infections. Infection prevention protects everyone in the healthcare environment, from patients to visitors. Strong sanitation systems reduce infection risks and support overall health and safety. Certain hospital areas, like operation theaters and ICUs, have higher infection risks. These zones require strict monitoring and specialized cleaning procedures to ensure safety. High-touch surfaces, such as door handles and bed rails, can quickly spread germs. Regular sanitation of these surfaces is essential to prevent infection. Effective infection prevention requires both cleaning and disinfection. Each step is crucial to ensure surfaces are safe and free from harmful microorganisms. Incorrect cleaning practices can increase contamination risks. Proper procedures must be followed to avoid spreading harmful microorganisms. Color coding helps prevent cross-contamination by designating specific cleaning tools for different zones. This system reduces the risk of transferring contaminants between areas. Hand hygiene is one of the strongest defenses against infection. Regular hand washing and the use of sanitizers are essential practices for healthcare workers. Personal protective equipment, PPE, reduces exposure risks for both workers and patients. Proper use of PPE is essential in maintaining a safe healthcare environment. Isolation areas require specialized cleaning to prevent contamination spread. Strict protocols must be followed to ensure these areas remain safe for both patients and staff. Improper disposal of biomedical waste can spread infection. Proper waste management is a key part of infection prevention strategies in hospitals. Air quality plays a significant role in infection control. Proper ventilation and air filtration systems are essential in reducing airborne contamination risks. A real-world example shows how strengthening protocols and increasing audits can prevent ICU cross-contamination, demonstrating the power of disciplined sanitation practices. Housekeeping teams must follow structured procedures to ensure effective sanitation. Consistency in cleaning practices reduces contamination risks throughout healthcare operations. Continuous monitoring is essential for effective infection prevention. Regular testing and audits help identify and address contamination risks before they lead to infections. Emergency spills require immediate response to prevent contamination spread. Proper procedures and equipment are essential for effective spill management. Continuous staff training strengthens infection prevention efforts. Well-trained teams ensure consistent safety and sanitation practices across all shifts and departments. Infection prevention is everyone's responsibility in healthcare. Collaboration among all staff members ensures a safe and healthy environment for patients and visitors. Proper chemical usage is crucial for safe sanitation. Selecting, diluting, and storing chemicals correctly prevents harm and ensures effective infection control. Explore the essentials of cleaning chemicals, disinfectants, and their safe usage in healthcare settings. Hospitals require specialized cleaning products to ensure safety and effectiveness. Ordinary household cleaners just won't do. Cleaning and disinfection are distinct yet complementary processes crucial for maintaining a safe healthcare environment. Different hospital areas require specific disinfectants due to varying contamination risks. Hospitals use a variety of disinfectants, each with specific applications and safety instructions. Improper chemical usage can lead to significant health risks for both staff and patients. Accurate dilution is crucial for effective disinfection and safety. Contact time is essential for effective disinfection. Follow guidelines to ensure safety. Consider surface compatibility when selecting cleaning chemicals to prevent damage. Chemical labels provide essential safety information that must be understood and followed. Proper PPE is vital for chemical safety in housekeeping tasks. Proper storage conditions are crucial for chemical safety and effectiveness. Fast response to chemical spills is essential to minimize safety risks. Eco-friendly cleaning solutions are becoming increasingly important in healthcare. A case study on improving disinfection safety through proper investigation and training. Healthcare staff must understand hazard symbols to ensure safety during chemical use. Automated systems improve consistency and reduce waste in chemical usage. Standard operating procedures ensure consistency and safety in housekeeping tasks. Safe chemical usage protects hospital infrastructure and reduces costs. Professional sanitation requires technical knowledge and understanding of various factors. Cleaning procedures must adapt to different hospital areas based on risk levels. Explore comprehensive hospital cleaning procedures and area-specific hygiene practices essential for modern healthcare facilities. Hospitals have diverse environments, each requiring specific cleaning protocols to ensure safety and sanitation. Effective hospital cleaning relies on structured systems, including schedules, infection control, disinfection, and monitoring. Patient rooms require regular cleaning to maintain a safe and infection-free environment, focusing on beds, surfaces, and washrooms. Operation theaters demand rigorous sterile procedures to prevent any risk of infection, ensuring patient safety. ICUs need stringent hygiene practices due to the vulnerability of patients, involving close collaboration between staff and infection control departments. Isolation rooms require specialized cleaning protocols to prevent cross-contamination and protect vulnerable patients. Emergency departments experience high patient turnover, necessitating rapid and continuous sanitation efforts. Washrooms are potential contamination sources and require frequent cleaning to maintain hygiene standards. Laboratories need controlled sanitation to prevent biological hazards, involving careful handling and documentation. Clean public areas in hospitals create positive first impressions and influence patient confidence and satisfaction. High-touch surfaces in hospitals require frequent disinfection to prevent infection spread and ensure patient safety. Proper floor cleaning is crucial for infection prevention, utilizing specialized equipment and disinfectants. After patient discharge, terminal cleaning ensures rooms are thoroughly sanitized, ready for the next patient. A real-world example shows how improved sanitation protocols can enhance hygiene in emergency departments. Different hospital areas require varying cleaning frequencies based on risk levels, ensuring effective hygiene management. Using the right equipment enhances cleaning quality and reduces cross-contamination risks in hospitals. Structured movement patterns in cleaning prevent recontamination and enhance sanitation efficiency. Digital tools enhance cleaning accountability, providing real-time data and compliance tracking in hospitals. Consistent cleaning practices enhance patient safety, trust, and hospital reputation, meeting regulatory standards. Proper waste handling, including segregation and disposal, is vital for maintaining hospital hygiene and preventing contamination. Explore a comprehensive guide to the safe handling, segregation, transportation, and disposal of healthcare waste in modern hospital environments. Hospitals produce various types of waste daily, including used syringes, contaminated materials, and more. Proper waste management is crucial to prevent infection risks and maintain hygiene standards. Biomedical waste includes infectious materials and requires specialized handling. Proper disposal is essential to prevent contamination and environmental damage. Immediate segregation of biomedical waste is crucial to prevent cross-contamination and enhance disposal safety. Hospitals use color-coded bins to ensure safe segregation of biomedical waste. Each color represents a specific type of waste, improving safety and compliance. Sharps waste poses significant risks if not handled properly. Always use puncture-resistant containers and avoid overfilling to ensure safety. Infectious waste may contain harmful microorganisms. Proper handling and strict protocols are essential to protect healthcare workers and patients. Housekeeping teams are vital in collecting, transporting, and monitoring biomedical waste, ensuring safety and hygiene across healthcare facilities. Personal protective equipment is essential for staff safety during waste handling. Proper use of PPE reduces exposure to infectious materials and chemical hazards. Waste transportation within hospitals must follow strict procedures to prevent contamination. Designated routes and sealed containers are essential for safety. Proper monitoring of temporary waste storage is crucial to prevent contamination and odor risks. Ensure ventilation, labeling, and restricted access. Various treatment processes, such as incineration and autoclaving, help reduce the risk associated with biomedical waste before disposal. Unsafe disposal of biomedical waste can lead to environmental hazards, affecting water systems and air quality. Proper management extends beyond hospital walls. Hospitals adhere to strict regulations for waste management, ensuring safety and accountability through documentation and compliance records. A case study shows how targeted training and monitoring systems can significantly improve waste segregation compliance in hospitals. Regular waste audits help identify gaps and improve waste management practices, transforming operations from reactive to proactive. Digital systems like barcodes and RFID improve waste tracking and accountability, streamlining waste management processes in hospitals. Quick response to spills involving hazardous waste is crucial. Proper procedures ensure containment and safety for all staff involved. Staff awareness and teamwork are vital for effective waste management. Each role, from doctors to housekeeping, contributes to maintaining safety standards. Effective waste management reduces infection risks and enhances healthcare quality. Staff responsibility and zero tolerance for failures are key to success. Staff safety is closely linked to proper hygiene management. Consistent use of PPE and adherence to safety protocols are essential for a safe working environment. A comprehensive guide to protecting healthcare housekeeping teams through proper PPE usage, safety protocols, and infection prevention practices in modern medical facilities. Healthcare housekeeping teams work around infectious materials, contaminated surfaces, biomedical waste, chemicals, blood spills, and patient care areas. Without proper protection, sanitation staff may face exposure to infections, injuries, and chemical hazards. Personal protective equipment, or PPE, helps protect healthcare workers during sanitation operations. PPE creates a protective barrier between healthcare workers and contamination risks. Proper PPE usage supports safer hospital hygiene operations, including gloves, masks, gowns, face shields, and shoe covers. Not every cleaning activity carries the same risk level. Hospitals select PPE based on contamination risk and operational exposure, ranging from basic to high-risk protection. Gloves protect housekeeping staff from blood, bodily fluids, chemicals, infectious waste, and contaminated surfaces during every sanitation task. Improper glove usage may increase contamination spread instead of preventing it. Always follow correct donning and doffing procedures. Healthcare staff may encounter airborne contamination, chemical fumes, dust particles, or infectious droplets during sanitation operations. Correct mask selection depends on operational conditions and contamination levels. Protective gowns, aprons, and uniforms help prevent contamination from spreading onto staff clothing and skin during cleaning activities. These barriers become especially important in isolation rooms and emergency spill situations. Chemical splashes, infectious fluids, and contaminated particles may create eye and facial exposure risks during cleaning procedures. Face shields and protective goggles help reduce injury and contamination risks during high-risk sanitation operations. Even high-quality PPE may fail if worn incorrectly. Healthcare workers require proper training on correct PPE usage procedures. A single error in PPE removal can transfer contamination to hands, face, or clothing, making proper training non-negotiable. PPE does not replace proper hand hygiene practices. Hand hygiene helps prevent contamination transfer during sanitation operations. Sanitize hands immediately after removing all protective equipment even if gloves appeared intact. Used gloves, masks, gowns, and contaminated PPE must be disposed of using biomedical waste management protocols. Improper disposal may spread contamination inside healthcare facilities. Housekeeping teams regularly use disinfectants, detergents, and other cleaning agents during hospital cleaning operations. Chemical safety is closely connected to staff protection. Isolation wards treating infectious patients often require advanced PPE including respirators, full body gowns, face shields, double gloves, and shoe covers. Isolation sanitation demands maximum safety devices. Housekeeping personnel may face risks from sharp objects, wet floors, chemical spills, lifting tasks, or equipment accidents during daily operations. Staff protection improves long-term safety outcomes. A hospital notices increasing glove misuse and inconsistent mask compliance among sanitation staff and takes decisive action to turn the situation around. Within months, staff safety compliance improves significantly. Healthcare housekeeping staff require continuous education on infection prevention, PPE usage, emergency procedures, chemical handling, and hazard awareness. Safety culture depends heavily on continuous learning. Blood spills, chemical leaks, infectious exposure incidents, and accidental injuries require immediate response procedures. Preparedness improves operational safety. Hospitals conduct safety inspections, PPE audits, workplace hazard assessments, and infection control monitoring regularly. Continuous monitoring improves staff protection standards. Healthcare housekeeping teams often work long hours in physically demanding environments. Healthy workers support healthier healthcare facilities. When hospitals prioritize staff safety, infection prevention, sanitation quality, and operational discipline improve together. Safe healthcare environments depend on teamwork, accountability, and proper protective systems. Modern hospitals increasingly use advanced cleaning equipment, automated sanitation systems, smart monitoring tools, and specialized hygiene technologies to improve safety and operational efficiency. Explore the essential tools and technologies that enhance hospital sanitation operations. Modern hospitals utilize advanced hygiene technology to ensure optimal sanitation and performance. Proper cleaning equipment is crucial for infection prevention in healthcare settings. Automated floor scrubbers enhance cleaning efficiency in large hospital areas. Specialized vacuum systems help reduce dust and airborne particles in healthcare facilities. Microfiber cleaning systems capture dust and bacteria more effectively than traditional methods. UV disinfection technology is crucial for infection control in hospitals. Electrostatic sprayers ensure even disinfection coverage across surfaces. Organized cleaning carts enhance operational efficiency in hospitals. Color-coded equipment helps prevent cross-contamination in hospitals. Automated hand hygiene systems significantly improve compliance in hospitals. Smart monitoring systems enhance accountability and quality control in hospitals. Air purification technology is vital for maintaining healthcare safety. Robotics are revolutionizing healthcare sanitation with efficiency and precision. Technology significantly improves hospital hygiene operations, as demonstrated in real-world examples. Regular maintenance of cleaning equipment is essential for effective sanitation. Modern technology reduces risks and enhances safety for hospital staff. Proper staff training is necessary for effective use of sanitation equipment. Technology supports sustainability goals in healthcare sanitation. Smart hygiene systems enhance healthcare quality and patient confidence. Hand hygiene remains a critical practice in infection prevention, even with advanced technology. Explore the essential practices of hand hygiene and sanitation in healthcare settings to prevent infections and ensure safety. Hand hygiene is crucial in preventing infections in healthcare environments, protecting both patients and staff. Contaminated hands can spread pathogens invisibly, emphasizing the need for proper hygiene practices. Proper hand hygiene protects both patients and healthcare personnel, ensuring safer environments. Hospitals implement structured hand hygiene protocols to maintain consistency and safety. Using soap and water effectively removes visible contamination, crucial for maintaining hygiene. Alcohol-based sanitizers offer quick and effective hand hygiene solutions in busy environments. The WHO outlines 5 critical moments for hand hygiene to prevent contamination during patient care. Proper hand-washing techniques are vital for effective hygiene, ensuring all surfaces are thoroughly cleaned. Gloves are not a substitute for hand hygiene. Proper hand-washing is essential before and after glove use. Housekeeping teams play a crucial role in maintaining sanitation culture within healthcare facilities. Monitoring hand hygiene compliance is essential for infection prevention in healthcare settings. Poor hand hygiene can lead to serious outbreaks, emphasizing the need for strict compliance. Patients and visitors play a role in maintaining hygiene safety through awareness and proper practices. A case study shows how structured interventions can improve hand hygiene compliance and reduce infection rates. Hand hygiene supports safe biomedical waste handling, crucial for infection control. Proper skin care is important for healthcare workers to maintain effective hand hygiene practices. Digital technology enhances hygiene monitoring, improving compliance and operational visibility. Hygiene awareness fosters a stronger safety culture in healthcare settings, reducing infection risks. Hand hygiene is a shared responsibility among all healthcare staff, ensuring safer environments. Hospital hygiene extends beyond surface cleaning, involving comprehensive sanitation practices. Chapter 11 delves into the critical role of laundry management and linen hygiene in hospitals, providing a comprehensive guide to safe linen handling, contamination control, and hygiene systems in modern healthcare facilities. Hospital linen hygiene is crucial for patient safety. Contaminated linen can contribute to infection spread, making proper handling essential in healthcare environments. Hospitals handle vast amounts of linen daily, requiring efficient systems for collection, transportation, washing, and distribution to ensure uninterrupted patient care. Improper handling of contaminated linen can spread infections. It's vital to manage patient use, transportation, and reuse without contamination. Segregating contaminated linen at the source is key to preventing cross-contamination in hospitals, especially in general wards, isolation areas, and ICUs. Color-coded linen systems improve hygiene control by making segregation visual, intuitive, and consistent across all departments. Personal protective equipment is essential for laundry staff, safeguarding them from contamination risks during linen handling and processing. Safe transportation of linen involves using sealed bags and controlled routes to prevent contamination in patient care and public areas. Laundry facilities must adhere to strict hygiene standards, ensuring all processes from washing to storage prevent contamination of linen. Proper washing temperatures and chemicals are crucial for removing microorganisms and ensuring linen safety for patient use. Clean linen must be stored safely to prevent recontamination, ensuring it remains hygienic for patient use. Linen used in operation theaters requires specialized handling and sterilization to prevent surgical infections. Linen from isolation areas needs separate collection and enhanced PPE protocols to prevent contamination spread. Housekeeping teams play a vital role in maintaining linen availability through scheduled collection, resupply, and room preparation. Regular maintenance of laundry equipment is crucial to ensure effective operation and prevent contamination risks. Digital systems, like RFID tags, improve linen tracking, ensuring efficient management and reducing manual errors. Properly laundered linen enhances patient comfort and reduces infection rates, contributing to overall hospital quality. Training staff in contamination control and PPE use is essential for maintaining linen safety and preventing infection spread. Effective linen management enhances infection prevention, operational efficiency, and patient satisfaction, supporting overall healthcare quality. Environmental hygiene in hospitals includes pest control, water hygiene, and air quality, ensuring comprehensive safety and sanitation. Explore a comprehensive guide to maintaining safe, clean, and pest-free healthcare environments through integrated environmental hygiene systems. Hospital hygiene extends beyond cleaning floors and disinfecting surfaces. Facilities must control pests, maintain air quality, monitor water systems, manage odors, and prevent contamination throughout the hospital. Insects, rodents, and other pests carry harmful microorganisms and contaminate healthcare environments, leading to dangerous bacteria spread and infrastructure damage. Hospitals must block pest entry by securing doors, windows, drainage systems, and more. Effective control reduces infestation risks. Improper waste disposal attracts pests. Overflowing bins and poor sanitation create ideal conditions for infestation. Scheduled waste removal and secure storage are key. Hospital kitchens must maintain high sanitation standards to prevent contamination. Regular inspections ensure safe healthcare nutrition services. Hospitals monitor water quality to reduce environmental health risks. Properly maintained plumbing prevents pathogen spread. Healthcare facilities must maintain clean air circulation to reduce contamination and improve safety. Air quality management is crucial, especially in ICUs. Bad odors can negatively affect patient comfort and healthcare perception. Fresh environments improve confidence and experience. Early identification helps prevent larger infestation problems. Regular inspections improve operational control and hygiene safety. Healthcare facilities work with licensed pest management professionals to maintain environments safely. Regular treatments ensure patient and staff safety. Pesticides must be used safely inside healthcare environments. Safety remains a priority during all treatment operations. Regular disinfection of surfaces reduces pathogen transmission. Pest-free zones and proper ventilation are crucial for infection control. Environmental hygiene extends to outdoor areas. Proper maintenance prevents pest attraction and maintains facility appearance. A hospital experiences repeated pest sightings near kitchen waste storage areas. Improved sanitation and monitoring reduce pest activity significantly. Regular audits of sanitation, ventilation, and drainage systems ensure comprehensive hygiene standards and compliance. Strong pest control systems require staff cooperation. Environmental hygiene depends on shared responsibility across departments. Modern hospitals use digital systems to enhance hygiene management. Automated sensors and reporting tools make monitoring more efficient. Healthcare organizations focus on eco-friendly pest control and water conservation to reduce environmental impact. Patients notice cleanliness and odors quickly. Effective hygiene systems improve patient confidence and healthcare perception. Hospitals must inspect cleaning and safety systems regularly to maintain hygiene standards and operational safety. Explore the essential practices for maintaining sanitation standards and preventing infections in healthcare facilities. Continuous monitoring is crucial for maintaining cleanliness in healthcare settings. Regular inspections ensure sanitation practices are up to standard, while consistent systems help maintain safety. Operational safety is enhanced through vigilant hygiene practices. Regular hygiene inspections are vital for identifying potential issues before they escalate into serious risks. Continuous monitoring enhances safety and accountability in healthcare environments. Quality control is a key component in preventing infections. By ensuring cleaning procedures, waste management, and disinfection protocols are followed, healthcare facilities can significantly reduce infection risks. Hygiene audits provide a structured review of sanitation systems, helping to measure performance, identify improvements, and maintain standards across healthcare facilities. Different types of hygiene inspections focus on various operational risks and safety protocols, from daily checks to emergency evaluations. Housekeeping supervisors play a crucial role in maintaining hygiene by conducting routine checks and ensuring compliance with sanitation standards. Checklists are essential for improving inspection consistency, covering areas like cleaning frequency, disinfectant usage, and contamination control. High-risk areas in hospitals require closer monitoring due to higher contamination risks, necessitating frequent inspections and stringent hygiene protocols. Environmental monitoring supports quality control by using advanced testing methods to evaluate sanitation effectiveness and ensure safety in healthcare environments. Accurate documentation is crucial during audits, supporting accountability and regulatory compliance across healthcare facilities. Infection control teams collaborate with housekeeping during audits to evaluate and improve hygiene practices, significantly enhancing safety standards. Waste management audits improve safety by ensuring proper segregation and disposal of biomedical waste, reducing contamination risks. Monitoring staff performance in hygiene practices supports compliance and identifies areas for improvement, strengthening overall sanitation efforts. A real-world example shows how audits can improve hygiene compliance by identifying issues and implementing corrective actions, leading to better outcomes. Digital technology is transforming hygiene audits, offering tools like mobile applications and AI monitoring to enhance transparency and efficiency. Accreditation inspections evaluate hygiene systems, ensuring compliance with standards for waste management, air quality, and more, supporting hospital accreditation. Corrective actions, such as staff retraining and workflow adjustments, improve operational performance by addressing identified issues effectively. Quality control in healthcare requires teamwork across various departments, emphasizing communication and accountability to maintain high hygiene standards. Continuous monitoring of hygiene practices protects patients and staff by ensuring high standards are maintained around the clock. Emergency situations demand specialized hygiene response systems to ensure safety during outbreaks, spills, and pandemics. In this chapter, we delve into the essential practices for managing sanitation systems during healthcare emergencies, outbreaks, and crisis situations. Hospitals must be prepared for emergencies, facing challenges like outbreaks, contamination, and natural disasters. Effective outbreak response, contamination control, and crisis hygiene are crucial for protecting patients and staff. Outbreaks can rapidly increase infection risks due to increased patient movement, contaminated surfaces, and exposure risk escalation. Fast responses are essential to protect vulnerable populations. Emergency cleaning requires immediate action and differs significantly from routine cleaning. It involves advanced PPE, rapid containment, and specialized disinfection protocols. Isolation areas become critical during outbreaks to contain pathogen spread and protect the broader facility. Key requirements include strict PPE usage and enhanced disinfection procedures. Spill management requires immediate action to prevent contamination risks. Secure the area, don full PPE, contain and clean the spill, and dispose of materials safely. PPE is essential during crisis situations to protect healthcare workers. Respirators, gowns, face shields, and double gloves provide necessary protection against exposure. High-touch surfaces require increased disinfection during outbreaks to reduce contamination spread. Frequent cleaning of door handles, bed rails, and other surfaces is essential. Biomedical waste volumes increase during crises, necessitating strengthened waste management systems to prevent outbreaks beyond the facility. Airborne infection control becomes more important during outbreaks. Air filtration systems, negative pressure rooms, and ventilation monitoring help prevent pathogen spread. Emergency cleaning teams require specialized training in outbreak protocols, contamination containment, PPE compliance, and hazardous exposure response to ensure operational resilience. Communication is critical during emergencies to ensure rapid dissemination of information and coordination among teams. Effective communication supports crisis management and operational safety. Emergency sanitation requires detailed documentation, including contamination incident logs, waste disposal records, and regulatory compliance files, to support effective crisis management. Pandemics change hospital operations completely, requiring patient flow reorganization, expanded isolation capacity, and rapid infection control implementation to reduce cross-contamination risks. A real-world example of managing emergency hygiene during a viral outbreak includes increasing cleaning frequency, deploying rapid response teams, and strengthening PPE monitoring to ensure safety. Emergency preparedness requires planning to improve response speed and protect patients and staff during unexpected healthcare emergencies. Operational readiness supports healthcare continuity. Technology supports crisis hygiene management by improving response efficiency and operational visibility. AI, UV disinfection, and automated systems enhance infection prevention during emergencies. Staff well-being is important during crises, with physical safety, mental well-being, and rest and recovery being essential to maintaining operational resilience. Environmental hygiene supports community safety by preventing pathogen escape and ensuring proper waste management and infection prevention during outbreaks. Crisis hygiene management requires leadership and discipline to ensure effective response protocols, rapid coordination, and operational discipline during healthcare emergencies. Professional growth opportunities in healthcare hygiene management continue to expand, with training in infection prevention, environmental safety, and crisis response becoming increasingly valuable. Explore the rewarding career paths in hospital housekeeping management, focusing on professional growth and certification opportunities. Healthcare hygiene management is now a specialized field, essential for infection prevention, environmental hygiene, and patient safety. Hospital hygiene professionals play a crucial role in supporting patient safety through various direct contributions. Career opportunities in healthcare facilities are vast for trained hygiene professionals, making their expertise highly valuable. Leadership roles in housekeeping are expanding, offering paths to supervisory and director positions. Effective communication skills are crucial for professional growth in healthcare hygiene management. Technology skills enhance career opportunities in healthcare hygiene management, offering tools for better sanitation tracking and cleaning efficiency. Infection prevention knowledge is highly valuable, especially post-pandemic, creating strong career opportunities. Professionalism in healthcare hygiene builds a strong long-term reputation through reliability, discipline, teamwork, and ethical behavior. Continuous learning is essential in healthcare to remain effective and competitive, with ongoing development in various areas. Certification in healthcare sanitation improves professional credibility and expands career opportunities. Safety awareness is a critical professional skill in healthcare hygiene, covering PPE usage, infection control, chemical safety, and waste management. Environmental sustainability in healthcare creates new opportunities, focusing on green practices and efficient resource use. Team leadership strengthens career growth by motivating, organizing, inspecting, and developing staff in healthcare hygiene management. A real-world example shows career growth through healthcare hygiene management, from starting roles to leadership positions. Healthcare hygiene management offers long-term stability, with consistent demand and guaranteed career growth. Professional networking supports career development in healthcare hygiene, offering new learning and employment opportunities. Adaptability is crucial for future healthcare careers, with skills in digital literacy, cross-cultural communication, and innovation. Hospital hygiene management supports global healthcare standards, offering cross-border opportunities and best practices. Professional hygiene leadership improves healthcare quality, emphasizing patient safety, satisfaction, and cost savings. Get professionally certified with CDG training to enhance your career in hospital hygiene management.